Hello, my name is Jessica Huang, and I'm a member of the Alumni Week Committee at the Harvard Chan School, where I graduated in 2020 from the Doctor of Public Health, the MPH program. To all the alumni out there from across the years, I just wanted to warmly welcome you to today's virtual alumni talk, as well as encourage you to get involved in our committee if you're interested in helping to shape future alumni lightning talks. As a recent graduate, I'd especially like to encourage other recent graduates to join and help bring a fresh perspective into our Alumni Week programming. Speaking of recent graduates, today I'm thrilled to welcome our featured speaker, Kasley Killam. She graduated from the Harvard Chan School in 2020 with a master's in public health from the Department of Social and Behavioral Sciences. Kasley is an award-winning innovator and the founder of Social Health Labs, where she partners with cross-sector organizations on initiatives to strengthen communities and address the loneliness epidemic. She's also a World Economic Forum Global Shaper, and her ideas have been featured in outlets like the New York Times, Washington Post, and Scientific American. I'm so excited that she can share work with us today in this Alumni Lightning Talk, as this topic is so highly relevant to all of us right now. Kasley, over to you.
Thank you so much, Jessica, for the introduction. And thank you to the entire Alumni Week Committee for inviting me to speak. It's an honor to be here with all of you. Not physically, but virtually. So as Jessica mentioned, my focus while doing my master's at Harvard Chan was on solutions for the public health issue of social isolation and loneliness. A few months before I graduated, the pandemic hit, which brought a whole new level of meaning and relevance to this topic. So today I'm going to share a bit about my perspective and some of the work that I'm doing in this space. So during our time together over the next few minutes, I'm going to first explain the problem, second, explore the solution, and third, take a peek into the future of what this space holds. So first of all, the problem. What is this topic of social isolation and loneliness? Well, for context, decades of research, including by certain faculty at Harvard Chan, have shown that social connection is one of the most important contributors to long-term health, well-being, and longevity. For example, people who have strong social relationships also have greater life satisfaction, stronger immune systems, better cognitive functioning, faster recovery times following illness or surgery, and even longer lifespans. In fact, one study found that socially connected individuals have a 50% increased likelihood of survival. Social ties as well are very protective. They actually prevent people from getting issues like inflammation, heart disease, or depression. So this is a very important component of our health. Yet, unfortunately, social isolation and loneliness are far too common in society. To give you a bit of a sense for this, 2 in 5 people feel like their social relationships are not meaningful. The majority of American adults don't participate in any kind of social group or belong to a formal community of some kind. Depending on which study you look at, anywhere from 20 to 60% of the US population is isolated or lonely. This costs an estimated $6.7 billion each year in Medicare spending, and that's just on healthcare due to social isolation among older adults, not counting the cost among younger generations, which studies have shown are actually lonelier than older adults. And finally, the risk of dying that's associated with social isolation and loneliness is similar to that of smoking and actually higher than that of obesity. So taken together, I hope you can start to see that this evidence really suggests that social isolation and loneliness pose a considerable public health risk. This was true before the pandemic, but it's certainly been brought to the forefront in a very new and relevant way. So second, the solution. What can we actually start to do about this problem? Well, the first step is to reframe it. Not everyone is socially isolated or lonely, and among those who are, not everyone wants to talk about it, right? But everyone can have a conversation about and benefit from strengthening their relationships. So first, this means moving away from focusing only on the negative to also emphasizing the positive. It means shifting from only addressing the deficits and what we lack to also building assets and promoting strengths. And it means complementing reactive solutions that respond to people who are already isolated or lonely with a proactive approach that actually prevents social isolation and loneliness in the first place. So the way that I like to reframe this conversation is to talk about social health. I define social health as the dimension of our well-being that comes from connection and community. So whereas physical health is about our bodies and mental health is about our minds, social health is about our relationships. So note that this is different from social determinants, which are really focused on economic and environmental influences for our health, such as food, housing, or education. Social health is really about our relationships and social connections. And even if you've never heard of this term before, I promise that you're going to start hearing more about it in the years to come. Advancing social health in society is truly my passion and the focus of my work. So the second step, once we've kind of reframed this conversation, is to intervene. And when you look at this screen, I hope you're having flashbacks to sitting in class at Harvard Chan, learning about the social ecological model, which I find to be a really helpful way of understanding an individual's health in the context of the community that they live in, the organizations that they interact with, and the broader society around them. It's also a really helpful way to recognize and identify opportunities to take action at all of these different levels to actually improve people's health. This is true for issues like smoking or obesity, which we commonly think of as public health problems, but it's also true for social isolation and loneliness. To prevent them in the first place and to actually create the conditions for social health to thrive, we must take this kind of comprehensive approach. And I'm a firm believer that every single individual, community, and organization has an opportunity and a role to play in this. So I'm happy to share that there's a lot of momentum and truly a movement underway to create more socially connected communities and improve people's social health. So I wanted to share a few examples from the social ecological model of actions being taken across all these levels. So one example at the policy level is the Elder Justice Reauthorization and Modernization Act, which, if it's passed, will dedicate $250 million to addressing social isolation and loneliness among older adults. Like I said, if this is passed, this will actually be the largest federal investment in social health in US history. So it's very exciting. An example at the community level is the Massachusetts statewide task force to end loneliness and build community, which I've been involved in for the past couple years. And we've been providing resources and changing social norms around social health through engaging community members, publishing reports with recommendations for community members, running a statewide awareness campaign, and much more. An example at the institutional level is the nonprofit Beyond Differences, which leads programs in middle and high schools across the US to really create a culture of belonging in schools and connect students in meaningful ways. An example at the interpersonal level is the Community Living Campaign, which is a nonprofit in San Francisco on which I serve for the board of directors. We run a program called Community Connectors, which basically creates local support networks. And as a result of this program, 93% of our participants report that they are less isolated and 100% report feeling more engaged in the community. And then finally, at the individual level, an example is that at Social Health Labs, we give out, which is my organization, we give out $1,000 each month to empower a grassroots individual community leader somewhere in the US who's connecting their neighbors in meaningful ways and really building relationships locally. So as you can see, there's a ton of momentum in this space. These are just a few of many examples that I could share in the US, but also in countries around the world. This is truly a global movement. So looking ahead, the question becomes, what can we do to really build on this momentum and solidify it to make sure that we're having lasting impact? Well, that is a big question, and it's not one that I can answer alone. So I recently launched a thought leadership series called Connect+Conversations in partnership with the organizations that you see here. We are sparking a national dialogue about how to address this issue across sectors, including technology, healthcare, urban design, and more. We plan to publish a report early next year that will summarize the different takeaways and recommendations. And we would actually love for you to participate and help us co-generate ideas and next steps to really embed social health in the fabric of our society and culture. And finally, the message that I really hope you will take away from this talk is that we can't improve public health throughout the life course without recognizing, appreciating, and acting on the impact of relationships or their lack thereof. Health is not only physical and mental, it's also social. So I invite you to consider how you can improve social health in your own life, but also incorporate it into your work as a public health practitioner. So with that said, if you are interested in getting in touch or learning more about this space, feel free to reach out on my website at kasleykillam.com or socialhealthlabs.com. And thank you.
Thanks again, Kasley, for the wonderful presentation. It's an inspiration, and I hope it's okay if I take a moment to ask a couple questions.
Absolutely.
Great. So first, fellow Harvard alum and current US Surgeon General, Dr. Vivek Murthy, has similarly been advocating for loneliness and social isolation to be seen as an important health challenge to address in today's society. So I'm really curious to hear your thoughts about, he wrote in The Atlantic about how we have tools to measure the economic recession during the COVID-19 pandemic, but we could also see lingering impacts from a social recession where damage to communal bonds during this health crisis could be harmful as well. And I know at the Harvard Chance School, we've often been talking about how to improve pandemic response and recovery policies. What do you think this should look like from a social health standpoint?
Oh, this is such a great question, Jessica, and one I've been thinking about a lot. I think that, and I love Vivek's piece that you referenced, by the way, in The Atlantic. It was such an important point to bring up. And it's been interesting to see the data emerging on whether or not the social recession is actually happening. I think a lot of people like me and like Dr. Murthy expected that social isolation would really, or social isolation from the pandemic and quarantines and so on, would really exacerbate people's levels of loneliness. It seems like early research is suggesting it's a bit more nuanced than that. People are more resilient than we expected, which is wonderful. It means that we're able to stay emotionally connected even while we're physically apart. But nonetheless, that said, that we're seeing a huge array of mental health effects, anxiety and depression and things like that. So it's certainly something to keep monitoring. As far as future pandemics or future natural disasters and other emergencies that we're going to deal with, I think you're absolutely right that social health needs to be an integral part of that. And the way that I would frame it or approach it is really thinking of social health as a resource, as a preventive asset that we invest in so that we can tap into it in times of need. So I think about emergency planning efforts, emergency preparedness rather, and the importance of cities, neighborhoods, buildings, things like that, really creating those social networks and social capital systems well in advance before we need them, so that people have those relationships in place that they can lean on and reach out to in times of need. I think a great example of this during the pandemic has been the rise of mutual aid groups, where people are just volunteering, matching things that they can provide with things that other people need at a very local level. And I'd love to see more investment in that, again, as a preventative strategy, as a resource that is already in place so that when disaster strikes, we're ready.
Thank you. I really love your take on using a proactive, preventative approach, and also how you're reminding us that there is room for optimism in all of this. It's a great point that we have found some ways to stay connected, especially leveraging technology like we are today with Zoom. So thank you for just reminding us that there is hope and work to be done. So on that note, I know you do such incredible work at the Social Health Labs, and we really thank you for sharing your work with us today. How can those of us who are listening from the alumni community do more to support your mission? It'd be great to hear more about opportunities for interested alumni to get involved, such as the Connect+Conversations that you mentioned during your presentation.
Yeah, thank you so much, Jessica. That's a great question. Absolutely. The Connect+Conversations event series is open to everyone. We would love for you, the alumni community, to bring your expertise to those conversations. They're very interactive and really meant to generate ideas together. So we definitely invite you to participate in those. I think other ways are, we're always interested in doing partnerships and building out creative programs, collaborating collaborating on events, publications, campaigns, a whole variety of things to really take action on this issue and start to drive forward progress in a meaningful way. So if you work at an organization or in some capacity are potentially interested in tackling this issue of social isolation and loneliness and promoting social health, definitely reach out. We're very open to collaborating. And I guess the final plug I would say is just we're also looking for more funding. We are a nonprofit initiative. So if this might be something you're interested in supporting, definitely get in touch.
Great. I hope we can all work together to address some of this. Thank you again for making time to join us today. To all who are listening, I highly encourage you to check out the other Alumni Lightning Talks that are being released, looking at health throughout the life course, both during the pandemic and beyond. And I also recommend watching our Thursday alumni panel on mental health and well-being, which is another great opportunity to hear more from Kasley and other colleagues on this important topic. So thanks again, everyone. Stay safe and please take care.
Thank you.